Every horse owner knows the frustration of a persistent cough or, an unexplained drop in performance. You feel like you've tried everything, but the root cause just stays hidden.
Right.
What if you could actually see inside their lungs at a cellular level and, pinpoint the exact issue?
Yeah, wouldn't that be something?
Well, today, we're doing just that. We're taking a deep dive into bronchoalveolar lavage fluid, or BALF cytology in horses.
BAL Cytology, yep.
It sounds a bit technical, maybe, but this isn't just a fancy phrase. It's often hailed as, well, the most insightful tool for diagnosing lower airway diseases in our horses.
It really is. So our mission today is to really understand what BALF actually is, how vets perform this pretty crucial diagnostic procedure,
Okay.
what healthy lung fluid looks like under the microscope, and maybe most importantly, how even subtle changes from that norm can reveal specific conditions.
Specific conditions like,
Well, we're talking about uncovering everything from different forms of equine asthma to even, clues of past internal bleeding like EIPH.
wow. So if you listening have ever wondered about that nagging cough or why your horse isn't quite performing at their peak, you're about to gain some really insightful knowledge about this vital diagnostic tool. You'll understand the why behind those vet recommendations and maybe feel better equipped to, advocate for your horse's health.
Exactly. Knowledge is power here.
Okay, so let's unpack this. How exactly do vets get this peak inside the lungs? What exactly is bronchoalveolar lavage? It still sounds a bit complex.
It does sound, yeah, but the concept is actually quite straightforward and honestly pretty elegant. Think of BALF as a highly specialized internal lung wash.
A lung wash.
Basically, it involves gently flushing a specific region of the lung's small airways and alveoli, those tiny air sacs, deep down with a sterile solution.
Okay.
And then carefully collecting that fluid back. It's kind of like rinsing out a specific room in a house and then analyzing the dust you collect.
That's a great analogy.
So the procedure itself is quite precise. First, the horse is typically sedated. Yeah, primarily for their comfort and cooperation, makes it less stressful for everyone. Then, a specialized, sterile, flexible tube. Often it's an endoscope, which lets the vet actually see where they're going.
Right. That makes sense.
That tube is carefully guided through the nostril, down the windpipe, the trachea, and then into one of the lower airways until it gently wedges into a bronchus.
Wedges.
Yeah, it sits snugly. This ensures we're sampling a very targeted area deep in the lung.
Oh, okay.
Once it's in place, a warm, sterile saline solution, typically about 250 to 500 milliliters, is rapidly infused into that section of the lung.
That sounds like a lot.
It does, but it's relative to lung size, and it's
Yeah.
done quickly. And almost immediately, that fluid, now mixed with cells and secretions from the deep lung, is aspirated back out into a sterile collection container.
So it goes in and comes right back out with the sample.
Exactly. This collected fluid is then transferred to special tubes, usually EDTA tubes, to stop clotting, kept cool on ice, and sent off to a diagnostic laboratory pretty quickly.
Got it. And then the lab takes over.
Right. At the lab, they process the fluid. Often they'll spin it down using a centrifuge, and then they make thin smears onto slides. Cytospin preparations are preferred, really concentrate the cells.
Okay.
These slides are then treated with special stains. Think of them like color filters for the cells. Common ones are Romanowski types or May-Grunwald Gemsa. These highlight different cell types under the microscope.
So you can tell them apart easily?
Pretty much. Makes it much easier to spot, say, neutrophils versus macrophages versus mast cells. Sometimes they'll use colluidine blue specifically for mast cells, and in specific cases, maybe if we suspect pneumocystis in an immunosuppressed horse, other specialized silver stains might be used.
So it's really a minimally invasive way to get a microscopic sort of biopsy of the lung's inner workings.
That's a good way to put it, yeah.
And I imagine that precision from the collection method to the staining, that's what gives it its diagnostic power.
Absolutely. It's all about getting a clean, representative sample from the right place and visualizing it properly.
Which brings us to, well, the really crucial question. Why is this procedure considered so important? Why is it the gold standard, as you said, for diagnosing these lower airway diseases in horses?
Well, it's considered the gold standard primarily because it directly samples the cells lining the bronchioles and the alveoli.
Right down where the action is.
Exactly. That's where many of these non-infectious lower airway diseases like asthma actually originate. And the real power here is that these cellular changes often appear long before you see clear clinical signs.
Before the cough even starts.
Often, yes,
Yeah.
or before the performance drops noticeably. It can be predictive, not just reactive.
Mm.
It allows us to catch these subtle inflammatory processes simmering deep in the lung, sometimes weeks or even months before the horse might show obvious symptoms to the owner or trainer.
That's incredible. Proactive lung health monitoring almost.
In a way, yes. This direct cellular access gives us just unparalleled insights. For instance, take equine asthma syndrome, or EAS. That covers both the mild, moderate forms, what we used to call IED, and the severe form, RAO or heaves. For ecos, BAL cytology is, well, indispensable. It allows us to pinpoint the specific type of inflammation. It's mostly neutrophils, mast cells, eosinophils, maybe a mix.
And knowing the cell type matters
Because each cellular pattern points towards a different underlying mechanism, maybe allergy versus irritation, and gives us a specific blueprint for targeted treatment. It moves us beyond just, okay, the horse is coughing, let's try this.
more precise.
Much more precise. It's also incredibly valuable when horses have that chronic cough or, unexplained poor performance without obvious signs of infection. BAL cytology can often identify those hidden inflammatory processes.
So it solves those mystery cases sometimes.
It certainly can help. And we can even use repeated BALF cytology, say after treatment or environmental changes, to precisely monitor how well things are working. Are the inflammatory cells decreasing?
Okay, so monitoring response too.
Definitely. And then there's exercise-induced pulmonary hemorrhage, EIPH, bleeders. While scoping right after exercise can show active bleeding, BALF cytology can confirm past bleeding episodes. It does this by identifying specific cells called hemosiderin-laden macrophages. These are macrophages, scavenger cells, that have essentially eaten old red blood cells or their breakdown products.
So they're like evidence left at the scene.
Exactly. And these cells can linger for up to 3 weeks after a bleeding event, long after you'd see fresh blood on a scope.
Wow, okay.
It also helps us investigate less common things, too, like certain forms of interstitial pneumonia, maybe fungal issues, or even confirming exposure to environmental irritants, like certain pollens or dust particles, like silica, that have gotten past the horse's natural defenses.
So it's not just getting a diagnosis, it's getting this incredibly detailed cellular signature. It really transforms how you approach treatment, doesn't it?
It absolutely does.
Yeah.
It sounds like, as you said, the ultimate detective work for equine lung health.
That's just fascinating. But okay, the sample goes off, the lab does its magic. When the results come back, what are we actually looking at? What's considered normal? And what do those abnormalities really tell us about what's going on inside the lung?
Right. That's where the interpretation, the detective work, truly begins. In a normal, healthy horse, the fluid collected from a BALF should contain predominantly what we sometimes call cleanup crew cells.
Cleanup crew.
Yeah, mainly alveolar macrophages, typically making up maybe 40 to 70% of the cells. And then a healthy population of lymphocytes, those are key immune cells, maybe 30 to 60%.
Okay, macrophages and lymphocytes are the main players.
They are. Now, importantly, you expect very few, if any, neutrophils. Those are your acute fighter cells that rush to infection or acute inflammation. Normally, they should be less than 5%.
Very low.
Very low. Same for mast cells, usually less than 2%. And eosinophils, often less than 1%. Those are typically involved more in allergic or parasitic reactions. You might see a tiny bit of mucus or a few normal ciliated epithelial cells from the airway lining, maybe some binucleated macrophages. That's all normal.
Got it. So mostly macrophages and lymphocytes, very few others.
Exactly. Now, a quick important note on potential contamination. If the sample report mentions many squamous epithelial cells...
Squamous, like skin cells.
Sort of. They line the mouth and parts of the upper airway. Seeing a lot of them usually means there was some contamination from the mouth or throat area when the tube was passed down. It doesn't invalidate the lung cells, but it's something to note.
Okay.
And while we're on that, the total cell count and the total protein levels in BALS fluid, they're typically quite low in normal horses and aren't routinely measured for diagnosis in the same way they might be in other body fluids.
Right. So we focus on the types of cells present.
Precisely. When we talk about abnormalities, we're generally seeing a significant shift from that normal balance. Usually, an increase in one or more types of inflammatory cells, and often you'll see increased mucus as well. The specific types of cells that are elevated, they tell us a very precise story about the kind of inflammation happening.
Okay, so let's break that down. What are the common shifts?
All right. Probably the most common finding is neutrophilia, meaning an increase in neutrophils above that 5% baseline.
The fighter cells.
The fighter cells, exactly. This signals an active inflammatory process is underway. For example, in severe equine asthma, what used to be called HEAVES or RAO, you'll typically see a moderate to severe neutrophilia. We're talking often over 20 or 25% neutrophils, sometimes much higher.
A big jump.
A big jump. In the milder forms of equine asthma, formerly IAD, it might be a more modest increase, say above 5%, but maybe less than 20 or 25%. Still significant, though.
Still points to inflammation.
Absolutely. Neutrophilia also happens with acute lung inflammation, like a bacterial pneumonia or pleural pneumonia. In those cases, the neutrophils might look degenerative, kind of unhealthy, especially if bacteria are seen inside them.
Can you diagnose infection from BALF then?
Well, seeing neutrophils with intracellular bacteria suggests infection, but remember that contamination issue. For definitive bacterial culture, a transtracheal wash, or TTW, is usually preferred because it gets a cleaner sample from the trachea itself, less risk of mouth bacteria confusing things.
Okay, so BALF cytology points towards it. TTW confirms the bug.
Often, yes. You'll also see neutrophilia simply from exposure to environmental irritants, like dust, mold spores, even high ammonia levels from poor stable ventilation or wet bedding.
So stable management plays a role.
Huge role. And clinically, horses with neutrophilic inflammation might show that persistent cough, maybe nasal discharge, increased breathing effort, or just poor exercise tolerance.
Makes sense. What else do you see?
Another key finding is mastocytosis, which is an increase in mast cells.
Those allergy-related cells?
Exactly. An increase here, say above 2%, or some labs use a cutoff of 5%, is a strong indicator of an allergic or hypersensitivity reaction happening in the airways. This is a common phenotype in equine asthma.
The mastocytic type.
Precisely. Horses with this often have that chronic cough, maybe increased mucus production, and sometimes bronchospasm, that airway tightening.
Okay. And eosinophils.
Right. Eosinophilia, an increase in eosinophils, usually above 1%, or sometimes a higher cutoff like 5% is used, depending on the lab and context. This also strongly suggests an allergic process or sometimes a parasitic reaction.
Like lungworm.
Like lungworm, yes. Infection with Dictyocolus arnfieldi, the horse lungworm, can cause marked eosinophilia, often along with increased macrophages. You don't usually see the larvae themselves in the BALF, but the eosinophils are a big clue. It's also seen in another phenotype of equine asthma, and a condition called idiopathic eosinophilic pneumonia.
So mast cells and eosinophils both flag allergies or hypersensitivity.
Generally speaking, yes, they point strongly in that direction. Sometimes you'll see mixed inflammation, which is just what it sounds like, a combination of elevated neutrophils, maybe mast cells, maybe eosinophils altogether. This is quite common in various forms of equine asthma, showing a more complex inflammatory picture.
Not always just one cell type increased.
Not always, no.
Yeah.
And then, as we touched on before with EIPH, finding those hemosiderin-laden macrophages.
The evidence of past bleeding.
Correct. That confirms previous hemorrhage into the lungs. You might also just see notes about increased mucus or increased numbers of goblet cells, which produce mucus. That's very common in all forms of equine asthma and points to chronic irritation leading to excessive mucus production.
Clogs things up.
Exactly. And finally, you might see other things like fungal elements, spores, or hyphae.
Does that mean fungal pneumonia?
Not necessarily, and this is important. Finding fungal elements usually just reflects what's in the horse's environment, especially if they eat hay, and maybe suggests their natural airway clearance mechanisms aren't working optimally. It doesn't automatically diagnose fungal pneumonia, which is actually quite rare and needs other supporting evidence. Similarly, seeing plant material or other particulates often just indicates inhalation of irritants, maybe from dusty hay or bedding, which can trigger or worsen airway inflammation.
Okay, good clarification.
And one last point on what BALF isn't great for. It's not typically useful for diagnosing lung tumors. Neoplastic cells are rarely shed into the lavage fluid, and it might miss very localized problems like a small abscess or be less informative in very mild cases, or even some really severe chronic end-stage cases where the fluid just can't physically get to the worst affected areas because of damage or blockage.
It's incredible how specific those cellular changes are, though. They really do paint such a precise picture of what's happening at the microscopic level. It truly feels like a tiny forensic investigation inside the lung.
It really does.
So with all this detailed information, what are the most important practical things, the sort of key considerations for owners and vets when they're thinking about doing a BALF or interpreting the results?
Yeah, there are definitely some crucial nuances to keep in mind. First, always remember the sampling site. BAL samples a specific localized area of the lung, usually a lower lobe.
Okay.
While that's excellent for diffuse diseases like asthma, which affect the lungs broadly,
Right.
It might completely miss a very focal lesion, like a single lung abscess tucked away somewhere else. For those situations, your vet might need other diagnostics, like ultrasound or x-rays.
So it's best for widespread issues.
Generally, yes. Second, going back to contamination, some degree of upper airway contamination as the tube passes down is pretty much inevitable.
Just from passing through the nose and throat.
Exactly. And this means that if your vet strongly suspects a bacterial pneumonia and wants to know exactly which bacteria is causing it and what antibiotics will work, they'll usually prefer a transtracheal wash, TTW, for bacterial culture. The TTW gets a sample directly from the trachea with less risk of contamination from mouth bacteria. So BALF culture for bacteria is generally not recommended or reliable.
But the cytology, the cell analysis from the BALF, is still valuable.
Oh, absolutely. The cytology itself, looking at the types and numbers of inflammatory cells, remains incredibly valuable for diagnosing asthma, EIPH, and other non-infectious conditions, regardless of the culture limitations.
Got it. Cytology, yes. Culture, maybe not.
For bacteria, usually not from BALF. Now, crucially, clinical correlation is key. This is huge. BALF cytology results must always be interpreted alongside everything else.
The whole picture.
The whole picture. The horse's specific clinical signs, their history, what the vet finds on the physical examination, maybe lung sounds, response to previous treatments, other diagnostic tests. No single test result tells a whole story in isolation.
You need the context.
You absolutely need the context. Also, expert interpretation matters. Reading cytology slides accurately requires specialized training and experience. So samples should always be sent to a reputable veterinary diagnostic laboratory with board-certified pathologists or experienced cytologists.
Not something you eyeball in the clinic.
Definitely not for a definitive diagnosis, no. Another point. If your vet needs to perform repeated BALs, say to monitor treatment, it's important to know that the procedure itself causes a temporary mild influx of neutrophils into the lung. This usually peaks within about 48 hours.
So you wouldn't retest too soon.
Exactly. If you did a follow-up test, say, the next day, you might see an increase in neutrophils. That's just a reaction to the first BAL, not necessarily reflecting the underlying disease process worsening. You need to wait an appropriate interval.
Good tip.
And naturally, the treatment plan that follows. It's entirely dependent on the specific underlying cause identified by the cytology, combined with that whole clinical picture we talked about. Neutrophilic asthma might be treated differently than mastocytic asthma, for instance.
Tailored therapy.
That's the goal. And just briefly, while not typically done from the BALF fluid itself, sometimes other tests are part of the bigger respiratory workup, like a Behrman fecal exam looking for lungworm larvae, or maybe PCR testing of BAL fluid for specific viruses like equine herpes virus 5, which is implicated in EMPF.
So BALF is one piece, albeit a very important piece, of the diagnostic puzzle.
Precisely. It's not just about the numbers on a lab report, but about weaving together all the clues, the history, the exam, the cytology, for a holistic understanding of that individual horse's respiratory health. That's what leads to truly personalized and effective care.
That makes perfect sense. It's about understanding the whole horse.
Right.
Wow, what a deep dive into the, well, truly fascinating world of equine respiratory diagnostics. It's really remarkable how much insight can be gained just from analyzing a small sample of fluid from deep within the lungs.
It really is. BALF cytology is genuinely an indispensable tool. It's fundamental for diagnosing and managing these common equine lower airway diseases. It provides these crucial microscopic insights into the hidden inflammatory processes that directly affect his horse's respiratory health and ultimately their performance. It just allows for a level of understanding that translates directly into truly targeted and effective care.
Absolutely.
Yeah.
And think about it, this microscopic cellular detective work, it doesn't just reveal the cause of a cough or poor performance.
Right.
It actually empowers us, owners and vets together, to proactively manage the long-term respiratory health of our horses, helping them breathe easier and perform at their very best.
Well said.
It really makes you wonder, doesn't it? What other seemingly simple tests out there might hold such a wealth of hidden information just waiting to be uncovered if we know how to look?